dedicated teachers, so there will be less burden on the existing facility. So I think that's a welcome step. Okay. Having said that, there are a few things which we will now need to understand vis-a-vis when you're talking about research. So what I'm going to do in this 15-20 minutes is, what is the purpose? When something has introduced, there has to be a purpose. So what is the purpose of research in PG? What is the interrelationship between EPAs and research competencies? Outline of the curriculum, teaching learning method for the research, and most importantly, what are the assessment method? So that is what we are going to see in this presentation. So National Health Research Policy, they have insisted that the medical education system needs to develop a research attitude. And NCH has taken up it very seriously, and they have been doing in a greater way, and that's why they have incorporated research in its policy. At the same time, what I liked about HEB, Education Board, they have not talked only about the research from a general perspective, but they have insisted research should be from the homeopathic perspective, and that they have clearly stated that. At the same time, they have mentioned that it should be beneficial to the society at large, developing research temperament, and require requisite knowledge, ethics, and skill. And finally, we need to develop a professionalism. So when you talk about the homeopath is not only a clinician. He needs to learn. That's why he has to be academician. And in order to do a better practice, he needs to acquaint himself, and that's why the research component comes. So when you talk about the research, all these three, all these three components are important. Now, important thing we need to understand that when you talk about competencies and EPAs, okay. Now, research is a subject. Now, it is whose subject? Research is not of any particular department, and that's why there has to be a proper integration, because each department will have their own EPAs, and the research has competencies. And that's why there has to be a proper integration of EPAs and research competencies. So by acquiring research competencies, each specialty department will achieve their EPAs. And that's why it is very important for the specialty department to understand research and contribute in that, so that they can achieve their EPAs. Research has a specialty knowledge, and that's why it has their own competency. That's why the close coordination of a specialty department and research department is needed. So how this syllabus was thought and designed? Because we talked about that in a PG, it is more of an application based. So somebody wants to do a research. So what are the steps needed? And accordingly, the entire syllabus was designed. Naturally, it is a homeopathic research, and that's why we must know what is the research component and what is the homeopathic component. Then, obviously, we all say that research is all about moving from known to unknown. And that's why we should know what is known knowledge, and hence adequate literature search is needed. So that's the second part. Once you have adequate literature search, then you come to the problem. What is a researchable question? And you define a researchable question, you state the hypothesis, you define a specific objectives, and then you decide what is a methodology. So in a sequence, if you see, the methodology will come. Research is all about evidence, and that's why how to keep evidence and what are the evidences in research, that the component will come. So you conduct a research, you get a data. Now what do you do with the data? First you understand data, that's why the descriptive statistic will come. Naturally, with hard work, if you have done something, you need to infer, and that's why the inferential statistics will come. So whatever you have learned, ultimately it is for the patient, it is for the homeopathic community, and it is for the community at large. And that's why disseminating the knowledge is more important. So if you understand these steps from the homeopathic perspective, then the syllabus has been arranged in that way. And that's why the first topic comes is foundation of homeopathic research, and these are the things which will be covered in here. That is importance of research, because we all feel we are the practitioner, why research is needed. And with this attitude, if the outgoing professional will go, then after 15, 20 years, there is no new development. And if you want to keep homeopathy alive and higher, then the research is mandatory. Now, we all learn from a history, and that's why if you understand the life of Hahnemann as a researcher, you will learn a lot. Not only Hahnemann, but there are other stalwarts also. And that's why by doing this, we will learn what are the essential qualities of a researcher. If you get some of the qualities of Hahnemann, I think next another 100 years we can go. Okay. Naturally, the research basis, what is how homeopathic principles are developed, what is the research fundamentals behind that, relevance of research for the specialty, and there are different types of research. So first topic will cover all these things. Once you have a foundation, then you move forward, and so that you start with what is known knowledge. And known knowledge is a vast knowledge, and we need to understand the first why we are searching. And that's why the need and purpose will come. There are, in this era of AI, we have a lot of resources. The only thing is we should know which resources we should use and when. And that's why the source of literature will come. There are different types of reviews are available. When you do this review, you should know how to review. And that's why there are search queries. There are models are there, Picot model, Spice model. And as a homeopath, we should know these models. Now, it's not like when you do a literature search, you go only to the library. Yeah, the best thing is you search in the Google. But that's not the way to search a literature. And that's why there are a lot of medical search engines. So having a knowledge of medical search engine is important so that you get a relevant material. Naturally, when you take some material, you should have a knowledge of plagiarism, and obviously you should know knowledge of bibliography. Now, you have so much material, so you should have a reference management system. And that's why when you do all this, you are equipped with what is recent advances. And that is the topic 2 will cover this literature search. Once you do literature, the next thing is you know known knowledge. Then you have to identify what is researchable problem. And that's why the research formulation of the question, where you will require a lot of integration of a specialty department and the research department, so that a better topics, innovative ideas will generate. You define a research problem, you define a research question, you define a hypothesis, you identify variable. Research is all about managing variables. So once you know the variable, you can manage well. So all this knowledge is important, and that's why the next topic talks about the research process and proposal writing. So if you have a knowledge of this, then you can go ahead with that. Now, when you talk about the design, there are a lot of design. So broader classification is, there are quantitative design, there are qualitative design, and nowadays there are a lot of mixed methods are there. So the next chapter 4, 5, 6 talks about this area so that you are well equipped with this knowledge. Now each of this will give the purpose and philosophy of that design. We'll have to understand what is the application of there in that specialty. It is not that you are going to do suppose if you just want to understand the impact of the relationship of a miasm on a posology. If the person has a tubercular miasm, then what should be the posology as against the psychotic miasm? Then what you will do? You're not going to do experiment. And that's why here we should have a knowledge when to do observational study, when to do experimental study. So these are the certain things the PG student will learn so that he can apply in their specialty department. Each of the design has a specific data technique and a method of analysis. So it is not that the analysis, data analysis, biostatistics is separate and designs are separate. We need to understand for this particular design, this is a technique. So all this we need to cover in the next 4, 5, 6 chapters. The heart of research is evidence. Okay, so how do you do evidence? And that's why we must understand the concept of evidence-based medicine. If a professional understand the meaning of evidence-based medicine, that means for him, the life in his practice, it would be useful. Nowadays, I think all of us are practitioners. We know there are so many Google doctors are there. They come with the file with interpretation. Google has said this. Okay. So that means we had to know what is evidence-based medicine and how to keep evidences. We do fantastic cures, but we don't have records of it. Unfortunately, there are very limited case studies are present. And if you see there can be thousands of case studies, but since we don't have evidences, we can't reproduce them. And that's why the next generation must learn this, what is the evidence-based medicine. For their specialty, they need to develop special case record, because each project will have certain key item which they need to inquire. See, one of the things which normally what we see in a research is we need to record whatever is there. Okay, that's our understanding. Whatever the patient is suffering in terms of signs and symptoms, investigations, could be scale. Okay, and then you see the change subsequently. So what was there and what has happened subsequently. That's the way we talk about evidence. But it is one more component is also there. We also need to record what is not there, because what is not there is subsequently also not there. That means you have done something extra. Okay, and that's why developing a specialty case record or having that knowledge is very important. And there are a lot of software. Okay, we cannot shy away. I have not learned particular software. You need to learn. Okay, a youngster comes with mobile and they will tell you so many things. And if you don't keep updated as a faculty, then definitely after some time we will be outdated faculty. And that's why keeping updated is very important. Whatever you do, you have to do with ethically. And that's why the next chapter talks about ethics in homeopathic research. There are a lot of things to learn from the history, why ethics has come. At the same time, there are a lot of guidelines and regulation. I think in the current era, we should be aware of what are the current guidelines, what are the regulations, so that you can practice freely. It is not only about research, but even for the practice, you should know, okay, certain things as a part of a regulation. So all this point, we need to teach a young homeopath so that they can function better. Ethical functioning. What is the institutional ethical functioning? What are the composition? Ultimately, they have to present, they have to face ethical committee. Okay, and that's why they should be aware of how they are functioning, how they will be scrutinizing, so that the next phase, when they want to do for their dissertation, they can understand these are my ethical issues, how I'm taking care. Finally, patient care is most important. So that at the same time you get a knowledge, at the same time you take care of the patient. And that's why the next topic is about ethics in research. Okay, you have done so many things. Okay, that means everything right from the project you have done ethically, now you have to conduct the project. And that's why once you conduct the project as per the protocol, you are going to get lot of data. And this data, that means how to collect that data. Because keeping a record of data in a particular way, there are so many confusions are there when you talk about what is qualitative data and what is quantitative data. Okay, most of the time we get confused with the qualitative research and the qualitative data. And if you are confused at that level, then subsequently how we are going to understand the analysis part, data presentation part, and that's why basic concepts of biostatistics, types of data, collection, sorting out them, how we are going to sort out them, these are the important topics. Research is not possible without having a knowledge of sampling method and the sample, because representing sample for the success of dissertation is very important. We write 30 cases and then we take 30 cases whichever is available. Okay, we have been doing, but at least if you go one step ahead of that, then we'll be able to produce better research. And that is what this particular subject is, we are aiming for that. Naturally, sample size, because by and large we talk about 30, but 30 is not the number we have to remember. If your study is a qualitative, it can be done by less than 30 sample. And if you are doing an epidemiological study, maybe you require a 300 sample. Okay, so how to calculate sample size so that my conclusions are valid? And that knowledge the person should have. So all that part we are going to cover in a descriptive statistics. Once you do a descriptive statistic, you are going to get a lot of data for interpretation, and that's why the inferential statistic will come. There are a lot of tests are available, but again, a simple classification, whether my data is parametric or non-parametric, whether I am taking a before, after, or I have a repeated measure, whether I have a qualitative data or quantitative data. If you have that understanding, then subsequent analysis become easy. What I want to do, whether I want to go for a regression method, whether I want to do the analysis, coefficient, so all these things they will be able to do. Naturally, we know that we are not expecting our PGs to do the analysis part. Okay, there will be a biostatistics who will be doing. But for a biostatistic or a statistician, they are just numbers. Okay, if you just tell the pain is 8, he will not understand whether it is a qualitative way you have measured or a quantitative way you have measured. Okay, and that's why having knowledge of this test is important. You don't do the test, and that's why the actual calculation part is never there in our syllabus. We need to understand the concept, we need to understand its application. Moment you have application, then there are a lot of softwares are available. You don't have to depend on anyone. There are softwares available. You need to put the figure and the software. But you, like it's a machine, na? You should know how to operate, because otherwise garbage in, garbage out. If you put a wrong data, you are going to get a wrong result. And that's why having a knowledge is important, and that's why the knowledge of software, data management and analysis. If you have basic knowledge, then you can go ahead with your dissertation. Nothing is complete till you disseminate the knowledge. And that's a very crucial thing. And unfortunately, we as a homeopath are very poor in this. Okay, we have a very less number of publications. We have a very less number of presentation. The posters, we don't know how to make a posters. Okay, we put the same way data in a poster also, and in a presentation also, and verbally also with the same way. Okay, that's why it is important that we should know how to disseminate the knowledge. And the principle of that is a scientific writing. Moment you understand the scientific writing, that would be helpful for all these things. So that you can complete your dissertation, you can complete your thesis, you can write article, or you can present in a conference. And that confidence we need to give to our PGs. Because moment they will do, there are statutory needs, PG has to publish, PG has to present to the conferences, national level conferences. And if they are confident, finally we need to speak to the public. Okay? And if you can speak to the public, you can speak to the very well to the patient. Finally, It is, all those skills are important for their practice. So there is a standard template for each topic. There are learning outcome, knowledge, skill and reflection. There are learning methods are written. There are assessment methods are written. There are textbook and the domains, which domain this particular is going to cover. Okay, so for each table, so we are not going into details of that. So it is there, once you refer, you will be doing. Since it is a new thing, we need to know what are the different teaching learning method. Okay, so there is a theoretical component to it and there is a application component to it. And that's why there are a lot of learning methods are available and we should be equipped with all those things. There are certain things, since they may not be knowing, that's why there are certain things we need to teach them in terms of lecture. We need to demonstrate certain software and we should have an assignment. These are the basic things. Moment you go ahead, let them learn something, let them go to library, let them use e-resources, and that's why library, journal club, e-racing will come. Flip method, flip classroom, that's a very interesting method. They are PG, let them explore something, let them come back, and they will tell you something which we also don't know. And that's why when you talk about the research, usually the faculty and the student go hand in hand. And that's a better way of learning. So that they define the problem, so that a problem-based learning, problem-oriented learning, case-based learning is important. Group discussion, that's a brainstorming of ideas and how to put your point logically and not emotionally that our PGs must learn. Okay, we react emotionally when somebody is saying, no, it is not there, this is not possible. Okay, you have to put your point in a logical way, and that's why group learning method would be better when you are talking about selecting the topic, defending your result, because that is where you need to learn how to defend your result. So this method will come. Role play, naturally you have to present to the committee, you have to present to the audience, and then you have to practice. While doing that, you need to reflect on self. What is your progress? And that's why this last two things, reflective learning and self-regulated learning method, these are the important method so that PG keeps their own chart of their own progress. So these are the different learning method. Some we are using, some we will start using, and that's why the education research will come. My interest from the teacher is they should do educational research. Okay, take up one method, teach in a particular way, see impact, and then you will be producing a wonderful research article for the educational methodology. And I think that is a need where we can do a lot of educational research. So when you talk about specialty department and the research department, okay, so specialty department has all this knowledge, homeopathic orientation, problem-based communication, and if you see the journey, gradually it starts from the synopsis, where the focus is on the knowledge, the person should have a knowledge. Then it goes ahead with homeopathic orientation, because without homeopathic orientation, we cannot finalize the topic. As you are ahead, you define a problem, so it starts with the problem-based learning. Communication, because you need to disseminate the knowledge, and ultimately you become a professional. So research department, all these competencies, what we have enlisted from 1 to 15, will help specialty department to achieve their. So if you take one example, like synopsis, how does the synopsis will work and how we will work as a team? And that is very important, because creative thinking, what should be the topic, is a specialty area. Because the specialty department teachers know their subject very well. But how to define a problem, maybe a research department will help. And that's why the integration will come. Literature search, the technique will be taught by the research department. But what is the relevant research? Where to search? That's a specialty department. And that's why there is a lot of coordination is needed for defining the research question and deciding the robust method. And that's why once you do this, so that you can define the integration, the meeting points where the specialty department and research department will work together, define a problem, collectively collect something, and finally the specialty department will achieve its EPS. And that's the bottom line. So if you take an example of pediatric department, now pediatric department has enlisted wherever there is a word research, I have found out, okay, there are EPS, they have mentioned research, okay, so how to do that? So this is what they want to achieve. Now if they want to achieve this, they want to have a leading healthcare team or training activities, patient care. So where the research will come? And if you see, there are a lot of areas where you can have a research, like simple identification of a diagnostic scale. There are a lot of scales are available, but which scale is valid, reliable? I think the research will help you. There is a screening test and there are actual diagnostic tests. So screening test will have a more of a sensitivity but less of a specificity. Whereas in a diagnostic it would be reverse. So what is the meaning of sensitivity and specificity? Once you understand, then you don't have to by heart why this is a screening test and why this is a diagnostic test. Treatment strategies. Okay, as a department you will see hundreds of cases. If you select one, what is the treatment strategy? So how to generalize? So how to generalize, the research will tell you, but how to do is the specialty department, so that they can conclude. Like maintaining professional document. So there are a lot of things which can be done jointly. So what I realize, the conceptual framework will be done by the research department, but the application part is a specialty department. And that's why this integration is very important. The pattern, the question paper patterns remain the same. That is the standardized all across now India within that, thanks to educational board, because there is a system, everybody is clear of that. So when you talk about application based, what kind of a question will come? I'll give some example. These are just example and we can elaborate on that. Now, this particular researcher wanted to study epidemiological study to understand the prevalence of cancer. Okay, now he wants to do in a rural Maharashtra. So right from what should be the sample, how should be the question, what should be the research question, what should be the aim, what should be the design. Okay, he need to think over it and apply so that he can write in a better way. So that whenever he wants to take up something, he has already undergone certain training, and that's why gradually we can trust him. Yes, if he has done somewhere, he can do in a future. Another example, now OBGYN patient, one of the doctor is prescribing homeopathic medicine, other is not making. Now how to have a design for this? What are the variables? What should be the inclusion-exclusion criteria? How to calculate sample? These are all application-based questions. The long question also can be like some theory part and some of the minor application part. Because PG is all about application. So what is the meaning of population and sample? There are different types of sampling. So explain sample with a suitable design. Or it can be exploring the role of treating. So what can be the literature? What should be searched? How to formulate the queries? Okay, this can be the long question or any related to statistics. Take up one test, describe its concept and its application. This can be some of the long questions. SAQs, composition and function of IEC can be a very small thing which they can say. Now there are, as you go into intricacies of research, there are errors, type 1, type 2 error. These are very crucial. So, but you need to understand in brief. So you can write only small. So all these questions can come for short answer question. Graphical data presentation, or take up one test and explain that particular test. So that we are covering entire research methodology as well as biostatistic part. So at the conclusion, this is the first time I think department has started. So we all are at the beginning stage. Even our PGs are at the beginning stage. So they need to learn the competencies. If you learn the specific competencies, then gradually you can apply them in a better way. So acquiring competencies will help department to achieve EPA. And that's a coordination we are thinking so that you gradually move in a little faster pace. Once you understand that, then you can apply in your dissertation, you can do in a better way. And if there is a close coordination between the specialty department and the research department, then you will sprint. Finally, you will evolve into a proper professional who has what the NCH and educational board have decided: homeopath, a competent clinician, academician, and researcher, so that you will develop a lifelong attitude. And definitely, I would like to thank Chairman Khurana sir, President Tarkeshwar sir, Jatkar sir. I don't know how many times we might have troubled him, and he has been there to save us. My colleagues, Dr. Divya Taneja and Subranil Shah, they have been very instrumental in finalizing the topic, because there were a lot of debate, this should be there, not should be not there, what we call as a brainstorming session, and they have been part of that. Our PG core committee members, Munir Ahmed sir, and Bipin sir, who has taught a phenomenal, our perspective for education has changed because of that. My colleague Devangini, she made the presentation so that we can put in a right way management and principal of Father Muller, and all of you who has been patiently waiting for lunch and listening. Thank you very much.